Good communication with doctors is important to get the most out of your visits. Your doctor is the expert on medicine and medical treatments for your condition. However, you are also an expert. You know your body, your past health history, and your life conditions that impact your health. It is important that you share this relevant information with your doctor so you can get the best care possible. We will present 5 key skills to help you improve your communication with your doctor. You may not need every skill in every visit. Use the word PACES to help you remember the 5 key skills. Here's what PACES stands for. P. Present information. A. Ask questions. C. Check understanding. E. Express concerns. S. State preferences. Before you go to the doctor, think about what you want to talk about. Tell your doctor what is important to you at the beginning of the visit so your time can be used most efficiently. When describing problems or concerns, be prepared to be specific and detailed. Meet Michelle and her husband Bob. Michelle already knows her diagnosis, and they have come today to talk about treatment options. Let's watch how Michelle and Bob present information to the doctor.
Before we get started, Doctor, I just want to talk about how Michelle's been feeling. She really has been really tired lately, so I want to make sure we get a chance to talk about that.
Thank you for bringing that up. We'll definitely have a chance to talk about that. I did want to check on a couple things regarding your... Now, Bob had mentioned earlier that you have been feeling very tired. Can you tell me more about that?
Yeah, I just feel exhausted. No matter how much sleep I get, I never know. Some days are harder than others. No matter how much I try to rest, I have no energy, and I just want to lay around, and it's so frustrating.
Well, from what you've described, it sounds to me like you're experiencing cancer-related fatigue or lymphoma-related.
Did you notice how Bob told the doctor at the beginning what he wanted to talk about during their visit? Also, Michelle presented details about her symptoms. You or your family member may not have similar symptoms to Michelle's, but you can still present detailed information to your doctor and present it clearly. As a patient or caregiver, it is your right to ask questions. It is a good idea to think through what you want to know and write down your questions before your visit. You may have other questions that arise during the visit. You should ask questions about anything you don't understand.
Okay, I've been talking a lot. What questions do you have?
Since I have this cancer, what is the likelihood that my sons will get it?
Well, that's a good question and a frequent one for individuals that suffer from lymphoma like yourself. Fortunately, we don't. Now, I see you wrote down some additional questions in your book before we came. Is there anything else on your list we haven't covered yet?
So I've heard that cancer treatments can cause nausea, and Michelle really has a sensitive stomach. So are there treatments that can better work with her sensitive stomach over others?
Well, yes, some patients have to deal with nausea and stomach issues. However, we have alternatives that can help with that.
Here we saw Michelle and her husband asking questions clearly and directly, some of which they had prepared before they came. Misunderstandings can result in poor health or quality of life. It is important that you check your understanding of what your doctor has said to you by asking the doctor to repeat or clarify information. You can summarize what you heard back to the doctor to ensure you understand. Previously, Dr. Mesa explained to Michelle some of the possible ways she could manage her fatigue. Let's see how Michelle and Bob check their understanding of what the doctor said.
Battle back against that fatigue. One way to combat fatigue is to make sure that you're doing some sort of structured exercise every day. At least 15 to 20 minutes, sustained, as a way to battle that fatigue. Now, your blood test will also tell us if you're anemic. So let's take a look.
What do you mean by anemic?
Oh, I'm sorry, I should have explained that better. It means a decreased number of red blood cells. And anemia decreases.
So, doctor, I just want to make sure I understand what you're telling us. So, if I get her to maybe go for a walk 3 times a week around the block, with regard to her fatigue, that's going to help her. At the same time, you're going to be monitoring her anemia, I think was the word you used, through blood work and things like that. So, am I understanding that correctly?
Well, that's right, although except if she's able, she should try to exercise at least 15 minutes every day,
all right.
but not too late in the evening.
All right.
Okay.
All right, got it.
Well, Dr. Mesa, thank you so much. Appreciate all the information you've given us, and I'm glad we have a plan.
Michelle and Bob did a few things to make sure they understood what Dr. Mesa was saying. Michelle asked Dr. Mesa to clarify when she didn't understand the term anemia, and at the end, Bob summarized what he understood should be done for his wife's fatigue. It was important that Bob summarized because he had remembered the recommendation for exercising differently than what the doctor said. Michelle tried what Dr. Mesa recommended for her fatigue and nausea, but neither seemed to work well. She and her husband knew they needed to speak to the doctor about these concerns at their next visit.
Well, it's good to see you again, both. I see you've had your first treatment. How are you feeling?
It's going okay.
Well, looking at your numbers, they look pretty good. Seems like things are working well. So why don't you keep it up, and we'll see you back in a month.
Well, doctor, wait. I don't think I'm doing okay. This nausea is too much for me. I don't think the medicine is working. Yeah, it's just I'm wiped out. It's making me sick.
Yeah, not just that, she's really tired. And we really have been trying to do what you told us to do.
Well, I'm glad you told me about this. So why don't we take one thing at a time? Why don't we start with the nausea? Is that nausea there all day?
Michelle was hesitant bringing these problems up to her doctor, especially because it seemed like he was in a hurry. However, it was important that she did this so her doctor could help her solve the problems. Tell your doctor your preferences for information and treatment, so together you can make the best decisions about your care.
Well, we have a new medication for nausea. We'll go ahead and give you a prescription, and we'll also give you a referral to a nutritionist to see if they might be of any further assistance.
And I'd really like to read more about, I guess, cancer-related fatigue. So are there any resources you'd recommend?
Fortunately, there are. The Leukemia and Lymphoma Society website.
Okay, well, doctor, I know you said we needed to wait and see how it went with the fatigue, but I don't want to wait. I can't function like this.
Well, let's talk more about what else we can do to try to help with some of the difficult fatigue that you're facing.
Here, we saw how Michelle and Bob stated their preferences, both for information and for her treatment. Please remember PACES for better communication. P. Present information. A. Ask questions. C. Check understanding. E. Express concerns. S. State preferences. For more information about communicating with your medical team, please visit lls.org/PACES.